Hi everyone, my name is Rachel, and for today's presentation I will be doing my mindfulness technique on deep breathing. The deep breathing method that I will be presenting today in this presentation will be boxed breathing. Breathing is a key element of mindfulness, and it has been shown to have many benefits, such as lowering blood pressure, reducing feelings of anxiety or depression. It can also reduce chronic stress, anger, hostility, and it can increase calmness in the body and mind, and can increase attention, which leads to better focus and mental clarity. Moreover, it's cost effective, easy to learn, and generally safe. However, it should be noted that some studies suggest it is useful for muscle fatigue, headaches, and other stress-related symptoms, yet there is limited evidence on these physiological adaptations that have beneficial effect on some common health disorders, including gastrointestinal disorders, migraines, chronic obstructive pulmonary disease, and asthma, and may improve sleep quality when performed before going to bed. However, these investigations are few and have notable limitations. However, deep breathing does present multiple health and well-being benefits for healthy individuals and those experiencing certain clinical conditions. Currently, breathing practice is widely applied in clinical treatments for mental health conditions such as post-traumatic stress disorders, anxiety disorders, phobias, and other stress-related emotional disorders. Box breathing can be used with older children, adolescents, and adults. Box breathing can be used with clients from different cultures and backgrounds, and it is good to use within a group setting and during one-on-one sessions with clients. Once clients become more familiar with implementing box breathing when needed, it can be implemented in different settings, such as at home, school, work, the grocery store, or wherever breathing can take place. Box breathing is not suited for everyone. While breathing can be used with younger children, box breathing might not be the best breathing tool for them, as they may not have the patience to learn this type of breathing, and they may need more immediate relief just from taking deep breaths in and out. Shortness of breath is a common pregnancy symptom due to changes in pregnancy and how it affects the body. Box breathing slows down the respiratory rate, which could potentially decrease the amount of oxygen in the body, further making breathing more difficult for pregnant women. A healthcare provider can give you guidance on whether box breathing is appropriate during pregnancy, and individuals with high blood pressure should talk to their provider before box breathing for the first time. Though deep breathing can have a positive effect on high blood pressure, talking to a healthcare provider before beginning a new exercise with underlying conditions is always very wise to do. Deep breathing can also cause a small minority of people to feel dizzy, lightheaded, or anxious. So it is always good to check in with your client before and during and after deep breathing exercises. As social workers, we often work with clients who experience anxiety and stress and can become easily overwhelmed in a variety of situations. While meeting with clients at my practicum, I have had clients become very anxious and overwhelmed that we had to stop in the middle of our session or during an assessment in order for us to take a moment to do some deep breathing to help mitigate them becoming overwhelmed and anxious. One exercise that can be used is box breathing. The steps for box breathing are as follows. 1. Get into a comfortable position. Breathe out slowly, releasing all of the air from your lungs. Breathe in through your nose as you slowly count to 4 in your head. Be conscious of how the air fills your lungs and stomach. Hold your breath for a count of 4. Exhale through your mouth for another count of 4. Hold your breath again for a count of 4 seconds and repeat this 3 or 4 times. Be sure to check in with the group or the client after your breathing exercise. The diagram below shows how box breathing works. You take an inhale through your nose for 4 seconds, and then you hold it for 4 seconds, and then you exhale throughout your mouth for 4 seconds, then you hold for another 4 seconds before repeating the process and inhaling through your nose again. So here is a demonstration of box breathing. If you were working with a client, it might look something like this. Sam, I'm going to pause here for just a moment as I can see that your body is tense, your breathing is shorter and faster, and it seems like talking about your current living situation has caused an increase in an anxiety and a sense of overwhelmingness. What I'd like to do, if you're okay with it, is engage you in a breathing exercise that can help calm our minds and bodies when we start to feel anxious or stressed. In this case, Sam agrees. Sam, we're going to do what's called box breathing. So go ahead and get into a comfortable position in your chair and relax with your hands down on your legs. And if you're comfortable, you can go ahead and close your eyes and just breathe through your nose for a count of 4 seconds. Then we will hold your breath for 4 seconds before exhaling for 4 seconds. Then we'll hold for 4 more seconds and then inhale for 4 seconds. Then exhale for another 4. Then we'll hold again before repeating the cycle. While you're doing this, I want you to focus just on your breathing as your air fills your lungs and stomach and nothing else. I know this sounds a little confusing, so I'm going to go ahead and demonstrate it for you, and then when you're uncomfortable, then we can go ahead and do it together, okay? So I'm going to get in a comfortable position. I'm going to place my hands on my legs. I'm going to close my eyes. I'm going to exhale all of the air that's already in my body. And then I'm going to breathe in for 4 seconds through my nostril. I'm going to hold for 4 seconds. I'm going to exhale through my mouth for 4 seconds. And I'm going to hold for 4. So go ahead, Sam, whenever you feel ready. We'll do it together. Breathe in. Hold for 4. Exhale. 3, 2, 1. Hold for 4. And at this point in time, the client and I have done that for a couple of minutes, maybe, or at least 3 to 4 times, depending on how the client feels. Now, after we've done the breathing exercise, it's extremely important to follow back up with our client to see how they're feeling. So I might go ahead and ask Sam a couple of follow-up questions just to make sure that he's feeling okay. So Sam, now that we've engaged in some mindful breathing, how are you feeling? What are your thoughts around that mindful breathing exercise? And how would you like to continue to incorporate that mindful breathing in your session moving forward? If the client says that they would like to, I might ask how they would like to incorporate that, if they would like to engage that in all of our sessions, or how they would like to engage in that outside moving forward. This is a little different, I know, but again, with box breathing, it is just kind of that cycle of a box. That's why they call it box breathing or square breathing. Sometimes they do call it 4x4 breathing as well, or 4-4-4-4 breathing, because essentially everything is held in 4 increments. So yeah, so that's kind of what that would look like. And this concludes our presentation on mindfulness and for mindful breathing as it pertains to box breathing. Thank you so much.